You hear it, the alarm's going off. It's a code blue. You rush with your heart racing calmly but quickly to the room that is filled with chaos. What are you going to do? Today, I'm going to be going through what exactly you should be doing as a newer individual to medicine whenever you enter a room during a code blue. I'm going to be teaching you how to be calm and effective and act like you've been there 100 times. Hey, how's it going? My name is Reece. I'm a critical care transport nurse, an ex-medical ICU nurse, and an ex-level 1 trauma ER nurse. I've been in a lot of codes, both train wrecks and run beautifully. I'm going to teach you the inside scoop on how you can be the most effective whenever you're really new to this area, because Lord knows we've all been there. Let's talk about the first 30 seconds of a code, because a lot needs to happen for a code to be run smoothly. First things first, if you are the first one in the room, start compressions. You're going to yell for help, and I mean yell. You're either going to press the code blue button, or you're going to yell out, I need a crash cart, or code blue, help, help, help. Let everybody know that this is going on. Do your best to stay calm. I know that sounds crazy after just telling you to yell for help, but the more calm you can stay, the more you're going to be able to think. Trust me, I know it's hard. You'll get the hang of it. Now, if you're not the first one in the room and people are doing compressions, here's a couple things that have to go on. We need oxygen, we need a backboard, and we're going to need to get the crash cart. Okay, those three things are super duper important. Next, we're going to talk about the different roles that happen during a code, because there's a lot of different things happening at the same time. Let's go back to talking about panic and keeping yourself calm. You are going to be in a panic. Most of the time, cardiac arrests are not anticipated. So it's going to be something that just comes at you at 100 miles an hour, and you're going to be fight or flighting like crazy. Now, what do? We take a deep breath. We take a step back, take a breath, and just move on from there, okay? The biggest thing that you can do during a cardiac arrest is focus on one thing. If you're going to 100 different jobs at the same time and bouncing back and forth, you're not going to be able to focus. You're going to be so distracted by everything else going on around you. You need to just pick one job and do that job as best as you possibly can. No one expects perfection. That's not how these things work. Everybody understands that you're going to mess up here and there. But if you focus on one job, take a deep breath, and just try to calm yourself down, you will be so much more effective during a code. The main roles that you'll see during a code is someone doing compressions, someone's going to be on airway, someone's going to be recording, someone's going to be running, someone's going to be on meds, and then someone is going to be shot calling. That is typically the doctor in the room or the most experienced person that's there. As the new person to the room, your job is to go stand in line for compressions. It's the best place to learn because you can observe the whole room. Now, the other thing you can do is be a runner. That's a really great opportunity to watch other people, things like the code cart, people like the recorder, or even the doctor during a code, because you get to listen to everything going on. Let's talk about airway. Now, airway is typically going to be taken by an RT or a physician if possible. However, if you are on airway, you're going to focus on bagging. You're going to focus on getting a good seal on the mask and also bagging. In teams of two, like on an ambulance when we're working, this gets really, really difficult. So you're going to want to get an advanced airway like an ET tube or an iGel, something that will hold that airway in place so you can just bag freely. Let's talk about the recorder. The recorder's job is to record absolutely everything that's going on in the room. They're writing down all the medications given, all the procedures that were done, the time the ET tube went in, anytime we get a different rhythm or ROSC or we defibrillate. It's a very hectic job because they got to listen to everything that's going on in the room, and a lot gets missed. So if you're the recorder, I would highly recommend being a little bit more experienced, because everyone's going to have to rely on you in the end. It's worth noting that typically the recorder will also be timing for epi and bicarb and whatever else is going on, and they'll also be timing the people doing compressions. So, like I said, recorder should probably be someone experienced, someone who knows what they're doing. One of the biggest things that you got to learn to do in a code environment is know what to say and what not to say, and also how to say it. Big things are really important to shout out. Things like epi given, or shocking, or clear, or ET tubes in. Things that the recorder has to hear should be said very, very loud, and things that don't necessarily need to be heard, things like excuse me, or I'm moving over here, things like that should be almost whispered, just to make sure that we're not distracting from the entire code. Last thing is the people on meds. Now, there's typically two people on meds, but one person can do it. One person's going to be on the code cart, one person's going to be at bedside pushing those medications, probably somewhere down below the waist area. The person on the crash cart should be very experienced, because they're going to need to be able to make meds on the fly, things like TPN or epi drips or anything of that nature is going to have to be made on the fly by an experienced person. The caveat to all of this is if you work on an ambulance, fun fact, these are all your jobs, so you'll figure it out as you go. It really comes with time. Let's go back to talking about panic and keeping yourself calm. You are going to be in a panic. Most of the time, cardiac arrests are not anticipated. So it's going to be something that just comes at you at 100 miles an hour and you're going to be fight or flighting like crazy. Now, what do? We take a deep breath. We take a step back, take a breath, and just move on from there, okay? The biggest thing that you can do during a cardiac arrest is focus on one thing. If you're going to 100 different jobs at the same time and bouncing back and forth, you're not going to be able to focus. You're going to be so distracted by everything else going on around you. You need to just pick one job and do that job as best as you possibly can. No one expects perfection. That's not how these things work. Everybody understands that you're going to mess up here and there. But if you focus on one job, take a deep breath, and just try to calm yourself down, you will be so much more effective during a code. Let's talk about what happens after a code. Now, obviously, there's only two outcomes here. But despite those outcomes, you really need to check in with yourself and with your team. It's a lot to go through a cardiac arrest, especially when you are newer to the field. Check in with yourself. Make sure that you're okay to go on with your shift. Take a deep breather. Take a 5-minute break. I've definitely had a couple where I just go take a seat for a couple minutes just to kind of breathe, and so I can move on and be present with my next patient. Okay? Check in with your team members. A really great thing to do is to have a debrief after a code. You get to talk about what went well, what didn't go so well. It really helps you kind of visualize what you should do for your next cardiac arrest and what needs to be improved for the unit as well. Do not blame anyone for anything because obviously we're all just human. Now, the next part about that is to maybe have a moment of silence as well. I found that those are really nice to have. It's obviously not the most important thing in the world, but it's nice to have a moment of silence for that patient to remember that that was someone that came in today and not just an arrest that you had. Remembering the patients is a good thing. If this content helped you maybe feel a little bit more confident during a cardiac arrest, please like and follow. I'm trying to make some more content about nursing education and medical education in general. I try to break down hard concepts into more bite-sized pieces. So let me know if y'all have any questions. Tell me what your code role is, because let's be honest, we all have one. I was typically on the crash cart if my nurse mom wasn't on the crash cart at the same time. But let me know how you're doing, and let me know if you have any questions. Have a good day.